Hello and welcome. This is actually a good start of the Mother's Day, which means the best gift is to give yourself or somebody give this gift to you to look younger like you were in 20s and 30s. So that's why we had our webinar set up today. So happy Mother's Day. We've been doing these webinars often, every other month or so. Basically, Mexico Cosmetic Center has been educating patients about the different procedures that we're offering in Mexico, also what the package includes, what we do down there, and what is medical tourism for plastic surgery. Again, if you have not filled out a health questionnaire, please go ahead and go to our website, mexicocosmeticcenter.com, and select the health questionnaire. That's the QR code. We do have a raffle. We are giving away an XSM therapy for the winner, which is $895. And you get up to $1,000 off of your surgery package. We try to cover as many questions that we feel like is frequently asked. So please pay attention. If you don't hear it, of course, you're welcome to add into the Q&A tab and we will cover it at the end of the presentation. Just a little bit about myself and Flora. My name is Ron Ellie. I've been in the medical tourism industry since 2007. I started Mexico Bariatric Center in 2012, and Flora and I launched Mexico Cosmetic Center in 2013, and I started the Hospital Azar in 2024, which has been a game changer for all of our patients coming to us. That's pretty much my credentials. Um, Flora is my beautiful wife. She is going to be with me today through the presentation. We do have two great coordinators that is in contact with you day to day, Tiffany and Lisa. And hopefully we get Lisa to join us at one time. We're working with Dr. Peter Lopez today to help us with this presentation. He is going to join us shortly. I mentioned about Hospital Azar, which has been a game changer in making our services so at the level that is internationally well known, and there is no competition at the level of service we offer. But it has also given us the flexibility to offer so many other procedures. For example, gynecology, hysterectomy, endometriosis. We would talk about hybrid procedures like we can do now. And of course, what we are presenting today is post-bariatric plastic surgery, or in general, plastic surgery. It has given us capability to treat pain and wellness with stem cell exosomes, and also procedures like orthopedic, whether it's arthroscopic or hip or knee replacement. Of course, MBC, I mentioned, Mexico Bariatric Center is a top provider for weight loss surgery in the world. We offer all types of procedures, and I'm going to touch base on this shortly, that bariatric surgery helps you lose weight, and plastic surgery refine your body, recontour your body, your face, but it kind of goes hand in hand. And I will tell you shortly. So these are just a list of the procedures we offer endoscopically or laparoscopically. Of course, Cosmetic Center can do all the procedures in the plastic and cosmetic, including facelift, nose job, tummy tuck, mommy makeover, breast lift, arm lift, thigh lift, which we go into detail later on. And again, we could do, for example, lipo with hysterectomy. Endometriosis, for example, we have the best team of surgeons that they deal with endometriosis, which is one of the very difficult procedures to diagnose and treat. As it in the forefront, we're in the forefront of plastics and bariatrics, and we are taking stem cell, power of stem cell to treat you before the surgery. So you not only have improvement in all your body organs from your skin, hair, bones, organs, joints, of course. You have an easier recovery with this package, which you call stellar stem cell pre-op. Again, I talked about arthroscopic surgery, and there is no limit of what we can do. Okay, so topics that we're going to cover today, we're going to talk about a little bit about MCC, Mexico Cosmetic Center, Hospital Azar, what Hospital Azar has given us to be able to offer to our patients. Then we talk about what's the patient process. We talk about all the procedures we offer in cosmetic plastic, including massive weight loss, skin removal. Then we talk about what our packages cover. We talk about stem cell, the power of stem cell, and using it for pre-op to get a better post-op recovery. And of course, throughout the presentation, I would tell you all the highlights of why you choose us, why you choose MCC. There are so many reasons to choose MCC. I would release the Zoom poll at one time before the Q&A session. Of course, while I'm still waiting for Dr. Peter Lopez to join us, and we would do the raffle at the end. I brought up the weight loss surgery procedures. There is a misconception that you can lose weight with plastic surgery. For example, lipo. Some patients come to us asking, oh, I want to lose weight with lipo. That's not how it works. First of all, lipo does not remove the fat around your organs. It's only under the skin, and it only can remove maybe 3 to 5 pounds. So that's why we are very strict about BMI, for example. Our surgeons are very selective, and we are not just about to take your money and say, well, just we give you the surgery regardless. We see this often in the United States even. Patients are over 35, 40, they still qualify them and they give them a tummy tuck or other procedures. So what happens is you need to lose weight to be a good candidate. And sometimes we see, not sometimes, often we see that the patients who get plastic surgery have to come back for bariatric surgery and then go back to a revision of their plastic surgery or mommy makeover or tummy tuck. So this is what we're trying to avoid. We do have a new program that we're adding as I speak about GLP-1. So if your BMI is high, you can talk to our coordinators so we can put you on a GLP-1 and take you down to the weight that is ideal, and then we can do the procedure. Again, for example, we have several patients right now that they approached us to get plastic surgery, and we send them to MBC for bariatrics to lose weight, and they came back. Now they're so happy because not only they look good, they're gonna stay thin, and they're gonna stay in their ideal weight. There is this also a question of when is the best time to do my weight post-bariatric weight cosmetic surgery. We recommend 1.5 years out. So what happens is you need to get again to that ideal weight and BMI so you can be successful in the long term. Okay. So 1.5 years is a good 1.5, maybe 2 years to do plastics after bariatrics. So why are we so popular and patients love us? Because we are giving you a full uh, all-inclusive package. So you don't have to worry about transportation, making your own hotel reservation, worry about the hospital quality, worry about the paid surgeon's quality. We're overlooking all these for you. We send We keep you enough time in the hospital. We send you in the hotel with a nurse to come and visit you because post-op care is a huge part of your success. So you have to remember that the surgery is giving you the initial tool to be looking great, right? But you have to do a good care from your incisions or, you know, to recover better and faster. And we are basically translating to quality, peace of mind, and we're the one setting a standard in this industry. For example, cost is always, there's always cost associated with everything. And of course, money matters. But for example, the procedures we offer, for example, in Mommy Makeover, is at least 50% of the price that you would pay in US or elsewhere. Now, not only that, you're getting a procedure with a super surgeon that can do multiple procedures in the post-bariatric patient in a time that is ideal. We will cover that shortly. These are complex surgeries. These are, so you say, why MCC? Why should I go with your company? We overlook all the aspects of your procedure, your travel. For example, one of the items that we are very sensitive and we really pay attention is the amount of hours that you are in OR under anesthetic. As we like to keep things within 6 hours, but do more procedures within that 6 hours. I know and I see surgeons that they keep patients under 9, 8, 9, 10 hours, and that is not a good idea because the longer you're under anesthetic, the more problems can happen, more complications can happen. It will not be as an easy recovery. So these are all factors that we look in MCC. So we are basically setting standard, what the procedure should look like, who the surgeon should be, and do all the mechanics and maneuvers that you need to do, whether you have to go from hospital to hotel to hospital. your post-op care, all that is included in the package. Our process is very simple. When you submit your health questionnaire, when you contact us, we assign a coordinator to you. We take your case and consult it with, of course, Flora, for example, has been doing this for years. She knows in and out of procedures. She knows in and out of which doctor you're supposed to go for what procedure. And remember, plastic surgery is very involved. There are surgeons that are really good with face. There are surgeons that are really good with body contouring. And we hook you up with the surgeon that is best for you. So we get the recommendation from the best surgeon that fits you, and we will give you a price that is exactly customized for your situation. At that point, you pay the deposit, we find the spot, and you make your travel arrangement, whether you drive or you fly. We start there and take over all the things that has to happen before you leave. We keep you enough nights in Tijuana, and we make sure you're well. So now one thing I need to mention is because of the high demand we have, for example, I think for May and maybe almost June, we have very little spots left in all of our surgeons' schedule. Okay. And so if you want a closer time or you want a time that really fits your schedule, I recommend you act faster. And honestly, because we have 4-5 surgeons available to us, we can still accommodate a lot of patients, but at the end of the day, they're all popular, they all do a great job, and they're filled up, so we have to act fast. Now, this is a part that I usually have Flora mention. So we want you to give us the pictures that can show the most that we can talk to the surgeon and get recommendations from. For example, these are the profiles we need you to upload when you do your health questionnaire for face. For body lift, for example, you need to have, so let's listen to that. So for the best consultation, we want you to have the pictures taken a certain way. There is an age limit, usually about 70 years old. And again, like I mentioned, we're very sensitive to BMI for your well-being. Patients who get scheduled, we like you to do a blood test about maybe a 1 month prior to the surgery, especially if you have had gastric bypass, gastric sleeve, duodenal switch, to make sure your hemoglobin is higher. So the more procedures that we do in one operation, the higher the hemoglobin needs to be. So this is why we have you do the blood test. So we make sure when you come down there, you are in the best shape for us to do the surgery for what you were planned and continue doing it. This is the type of support that you're getting day to day from us. You do the health questionnaire. We have developed complex algorithms that, first of all, we can identify what type of patients you are based on your health history. Then, of course, our surgeon liaison, Jen, is sitting in the middle of every health questionnaire going from you to the surgeon. We know which surgeon is good with what body part. Of course, if you ask any surgeon, most of the surgeons are good with body contouring. But if you ask them, hey, can you do face? You say yes. But are they really, really expert on that? That means, do they have the training? Do they have the skill? And do they have the experience to do that, have done enough facelift to do that? So as you see, we match you with the best surgeon that we feel is matching your situation. So you don't have to go uh, read and do research, because we have done that. We know how these surgeons work, and we match you with them. Again, if you have not done a health questionnaire, to enter to our raffle, please make sure you go to mexicocosmeticcenter.com and fill out a health questionnaire. We would do a raffle at the end, and I would release a Zoom poll before the Q&A. One of the factors of success is the support you get prior to the surgery and post-op surgery. Of course, for example, we have enough staff down there to take care of you. Isabella is our on-the-ground nurse that come visit you in the hotel if you select to go back to hotel after surgery. I need to mention that right now. So basically, our packages are not outpatient, okay? A lot of surgery centers that are less expensive, they don't have a hospital certified at the level that we do. And we keep you most of the time 2 nights in the hospital. That's huge for the recovery. We don't do the surgery and say, go home. After that, you have option. Hello, Dr. Peter. How are you? You're on mute.
Hello.
Hi,
Hello,
how are you?
Ron. Hi. So
Nice to-
fine. Sorry, I was thinking some problems to connect. Well, right now I'm here.
No worries. As I promised, Dr. Peter Lopez joined us. I was just mentioning um, about the fact that we are not an outpatient um, surgery center. We are a hospital with certification from the government of Mexico, health government of Mexico. We keep patients most of the time 2 nights in the hospital. That is huge in the success post-op care and recovery. And once we send them to the hotel, we still have the surgeon assistant, the underground nurse we have, Isabella, to go visit you, take care of your incisions and whatnot. So this is a level of care you get. And also our Facebook group, for example, has so many patients that they share their experience, how you need to do your pre-op and post-op and what to do to be successful. Um, as I mentioned, hospital has been a game changer for us, has given us so much um, leverage to do different procedures, do a good job in your care while you're there. Of course, the hospital experience, the environment is amazing. It doesn't look like a hospital because we built it in a very modern look, and you have 360 view of the um, beautiful Tijuana. The hospital is in a major prominent area next to the golf course, next to the best neighborhood in Tijuana, next to the hotel, which is we use Hyatt, and um, you get those beautiful views. You have a great experience, which helps you with your recovery. The name actually came as a tribute to my mother and is actually a Persian. It has a Persian origin, which means fire and light, reflecting the spirit of warmth and truth. Um, Again, the hospital is, I cannot say enough about it. The ORs, the recovery areas, the technology we use throughout the hospital, whether it's in the OR or is in the sterilization, we have the best equipment to offer you the best surgery. And so here's what I need to kind of um, we're off from our presentation. So when you get surgery, even in US, first of all, they you have to worry about preparation. You have before how to take care of things after. You have to read a lot of things. You have to worry about a lot of factors. You have to worry about your transportation. You have to worry about your recovery. And honestly, I have seen again, most of the places are surgery centers. And something, these are like under the hood, right? So there is a standard for hospital to get certification, which means you have, for example, white areas, gray areas, black areas. White areas is the clean areas that are OR. Gray areas goes the transition between a normal area and a clean area. I have actually witnessed in the surgery centers in US that the traffic, they go walk from the black area to the gray area to the white area and back. They don't change. They don't change their shoes. They don't change their clothes. They have a mask, but they use the same mask going to the public areas, going back. So honestly, and then they have like carpet on the floor. It's like it's amazing the standard of care and the way we're doing it in our hospital versus what is offered in US. It's just not even close. And of course, they charge you so much more money. They don't keep you, anything you do is outpatient. We don't just um, release you and say, just go home, take care of yourself. Okay. So, so that's why we recommend you come with a companion. But even if you don't come with companion, you still have our support all the way throughout your journey until you go back home. So now the companion can stay with the patient in the hospital, or you can stay in the hotel while your patient, your loved one is in the hospital. So you have that. And then again, like I mentioned, Hospital Azar is about a few blocks away from Hyatt. We're in a prominent areas. I actually um, always go by walking between hotel when I go down there and just walk to the hospital. It's, of course, it's more convenient for a companion staying in the hotel because they get free breakfast, but they can still visit you in a very 7 to 7 a.m. to 7 p.m. Hotel is one of the most sought hotels in Tijuana. Is 5-star and it has a great service for our patients. One thing that we need to mention as a general rule, of course, every patient, we're going to review your health history, tell you exactly what to do before and after for your medications. If you're taking something on a regular basis, when to stop, and when to start. But in general, don't take any NSAIDs or blood thinners 1 week before. If you are on Ozempic, GLP-1 medication, at least 2 to 3 weeks prior to the surgery, stop using it. Again, bring any bottle that you're taking on a regular basis with you, and we will tell you exactly what to do before and after, so you don't have to worry. So we like you to arrive before noon. That gives us enough time to do all that we have to do, get you prepared for your surgery. If you stay in the hotel the night, the pre-op night, or stay in the hospital, we will get all that situated. The next day you're going for surgery. Now, one thing I need to mention, if you select to get the stellar stem cell pre-op treatment, we need you to come at least 1 day earlier than that, which means you'll be arriving 2 nights before the surgery. That is giving us enough time to do everything else. If, again, is case by case. That's why we assign a coordinator to you at the beginning, and that coordinator tells you exactly when to come, when to leave, what to do, what medication to stop, what medication to start after surgery. Um, Again, most of the time we keep you 2 nights in the hospital, and every package is customized because we look at the extent of the surgery you've done, and we say, okay, we keep you one, of course, the pre-op night, 2 nights hospital, and then maybe three, maybe 2, 3, 4, even 5 nights post-op, whether you stay in the hotel or hospital. Of course, there is a little extra charge to stay all the way through the journey in the hospital, but it's worth it because you get nurses to take care of you. You get all that support from our hospital staff. That's actually something you may want to look into if you're coming by yourself. You're ready to go home. Again, we offer this innovative solution, stem cell pre-op. This is a package we offer, and it helps you with all these different scenarios, especially with your scar. Okay, scar care after, for example, mommy makeover is a huge factor for your success. Again, I cannot emphasize enough. And we will teach you, we will tell you what to use, whether you have to use a tape or whatever. So here, when I'm going to get Dr. Peter Lopez and get him started, he's, of course, a board certified plastic surgeon specialized in post-bariatric patients. Um,
Perfect. Can you hear me right now?
yes,
And can you see?
yes,
Yeah.
yes.
Okay, perfect.
Give you an introduction. So
Okay, perfect.
all of our plastic surgeons are board certified, but the specialization being having experience in post-bariatric patient is huge. Not every plastic surgeon can perform on a post-bariatric patient. This is something you have to remember. And of course, he's done years of um, college and experience doing surgeries, and now he's going to take over. And Dr. Lopez, please tell us all the different procedures. Of course, we offer a lot of different procedures, but these are the highlights.
Okay, perfect. Nice to meet you. I hope that you have a good day today. I'm really glad to be here. Let's start to talk about the facelift. Today, we're going to talk about facelift surgery and how this helps to restore a younger and more refreshed experience. A facelift is designed to improve sagging skin around the jawline, cheeks, and neck. Some patients only need a lower facelift. This is called the traditional facelift, but while others may benefit from combined with a neck lift for a better contour and harmony. That's a deep plane facelift. This is so important to let you know because the deep plane can help to keep all the results more time than a traditional facelift because the difference consists in the deep plane. We try to conserve the deep tissue that you have. But with the traditional, we only works on the skin. So that's the difference between that kind of facelift. This slide shows the deeper anatomy of the face and neck. One of the most important structure in facelift surgery is the SMAS layer, is the red one, and this is the deeper support system of the face. We work the deeper tissues to create longer lasting and more natural results while avoiding an overpull appearance. And so that's the reason that we always recommended to get a deep plane facelift. So the next slide, here we can see real patient result after facelift surgery. You'll notice improvement in the jawline, neck definition, and overall facial balance. The goal is always elegance and harmony, helping patients to look refreshed and no artificial. So you can see that it's the same patient but younger. So that's the point of a facelift. About the next procedure is the tummy tuck. Tummy tuck can improve the body contour, that's mean the abdomen area, in order to get flatter and a good shape of that. So there are too many kinds of tummy tuck. The first one is a mini tuck. This is just for the patient that are not post-bariatric patient. There are can be patients that have pregnancies and there are teen. So that's the kind of patient that are the good candidate for a mini tuck. About the standard tummy tuck, the extended tummy tuck, and circular tummy tuck are indicate for patients that have pregnancy, that have maybe sagging skin, and also that had the history of bariatric surgery. And about the fleur de lis tummy tuck and reverse tummy tuck is for patients that are in special conditions like predominant sagging skin in the central front area and patients that have too many sagging skin in the upper area, maybe just under the thorax. So that's the patient that we can get a tummy tuck. About the types of tummy tuck, you can see some pictures about how the incisions are performed. So this is not too important to get afraid because you're gonna get a too long incision because the point is to have a good result. So this kinds of surgery is really personalized to you in order to have the best result as possible. So about this, the kind of anesthesia that we always use is a regional anesthesia. This is the safer kind of anesthesia that you can have, and also the recovery is faster than another kind of anesthesia. About this, these are examples of tummy tuck results. We can see the improvement in abdominal contour, waist definition, and skin excess. In some patients, procedures are combined with breast surgery to create a more complete body transformation, like the patient that it is the second uh, picture. About the healing, one of the most questions of the patients is about the healings and the scar. The scar continued improving for several months and typical soften and fade over the time. Good scar care, hydration, nutrition, and following postoperative instructions are very important for optimal healing. So that's why we try to emphasize try to have a good nutrition, to exercise, and also we try to recommend you a kind of gel and cream in order to improve the healing process and the scar. About the breast surgery, the breast lift, you can see that many patients have this problem. Maybe too much gland, maybe a breath that's it's not it doesn't have a good shape. So the point about this is to get a better breast. Also, we can get these incisions because you can see that there are too much kind of incision, too many kinds of incision: the lollipop, the anchor, the donut, and the crescent. How we try to choose the incision? Well, like I said before, of the patient have indication. So we try to personalize and individualize the surgery in order to get the best result as possible. We can offer a combined procedure with the breast augmentation or the breast lift with liposuction. With also, we can use breast implants, and we can try to fold the upper pole of your breast. So that's the point about a good breast augmentation and a good breast lift, to look more natural and to look a good breast after the surgery. Also, about this, you can see the difference after the surgery. In the first picture, you can see a breast that it's not in a good shape. She is a post-bariatric patient. After that, we perform an anchor breast lift, and also we try to use implants that they are called teeny implants in order to improve the shape. So we can get a natural shape of her breast. So that's the point of this kind of surgery, to recover all this round shape of the breast and look natural. About the arm lift or bacterioplastic, remove the excess skin of the upper arms. This is especially common after major weight loss. Depending on the amount of excess skin, the incision can be smaller or more extended. That's why there are three kind of arm lift. The first one, it's called the mini arm lift. This is from the axillary area to the elbow. The standard arm lift can extend to under the axillary area, and the last one, this can be after the elbow area. So that's the point of to choose the better arm lift that you can get. This is other patient that you can see the change after the arm lift. It's amazing the change that she uh, gets up after the surgery. So she exercised after the surgery, and you can get how the muscle can be more the appearance of the muscle are better after the surgery, because she exercised after the surgery. So that's a good thing to know about the arm lift, that you can hide the scar, and also you can improve the shape and the muscle shape of your arms. About the thigh lift helps improve loose skin in the inner and outer skin. Some patients only need a limited incision, while others require a more extensive lift after significant weight of loss. So we can perform a regular, extended, or a spiral side lift. This is depends from of the shape of the scar. The regular side lift, it's a short scar, maybe 10 centimeters on average. The extended side lift, it's more extensive with a T-shaped scar in the inguinal area and also in the medium area of the leg. This can be maybe 20 centimeters with all of this incision. And after that, we can perform a spiral tiling. That means that incision can be from your buttocks to your groin to several areas of your thigh. So can be like a T, inverted T, the final scar. Uh, in this other example of tight lip healing and contour improvement has you can see has a swelling resolve. Patient noticed a smoother skin and better leg definition. So that's the point of this surgery. She got a extended thigh lift. It's come from the inguinal area to the knees. So you can see the incision because it's in the median area. That's the point of the surgery, to hide also the scar and be more natural as possible. Oh, this is the most the most like surgery, the mommy makeover. A mommy makeover is a set of cosmetic procedures that may include a breast lift, can be a augmentation, a reduction, and also a tummy tuck and a liposuction. Uh, if you want, we can use your fat in order to get a Brazilian butt lift. So we can add arm lift and a thigh lift to reshape and restore the body appearance after pregnancy, childbirth, or weight loss. So a full resume of mommy makeover depends of three procedures. So we can trade the abdomen area, the arms, and the breasts, for example, or we can combine the abdomen area, the breast, and the thighs. We also combine maybe a liposuction, a breast lift, and a tummy tuck. So an average three procedure can be performed in one surgery. That's called that is named like a mommy makeover. Three procedures that we can combine. Also, it's gonna depends of your levels of hemoglobin, the level of your proteins. So if you get that in a good levels, so we can perform maybe four procedures in one time. So it's gonna depends of you. This picture show us uh, two patients that the change that she can get after a mommy makeover. We trade the breast area and the abdominal area in this patient, so we can see the before and the after of this surgery. Also, it's gonna depends of your body. The result is gonna depends of your body. Maybe you are a patient that really likes the curves, or maybe you likes to look more fit. So it's gonna depends of you, because before the surgery we're gonna talk about the result that you want to after the surgery. So that's a good point to know. But you can see two kind of body in this slide. This is other patient that really likes a fit look. So you can see the change. We perform with the patients tummy tuck and liposuction and a breast lift. You can look the change of this patient. Also, the size of the implants we want to decide before your surgery, in order to have the best size for you. The Brazilian butt lift, this is a extra procedure that we can perform if we can make a liposuction. Why? Because the Brazilian butt lift, it depends of the amount of fat that we can get after a liposuction. Also, if you are a post-bariatric patient, we can't perform just a liposuction. You have to know that you can get so much shaggy skin. So you need to remove all the excess of skin, and also we can perform a liposuction, but just liposuction like the only procedure this can be performed. So that's a point so important to let you know about the Brazilian butt lift. Butt lift need a liposuction, but also a post-bariatric patient needs a cut of skin, but also a liposuction. This is a patient that we perform a tummy tuck liposuction and Brazilian butt lift. So you can see the change of the shape of his hips and her hips and the butt. Okay, this is so important because previously we talked about the cares of the wounds of the scar. So you can see that the scar care is very important after the surgery. We commonly recommend in silicone tapes. Scar helps to help scar heal flatter, softer, and lighter over the time. Remember, it can take 2 months, 3 months, maybe 6 months in order to improve all of the shape of the scar. Okay. Okay, returning to work. This is so important because maybe many patients works. So we need to know um, how many weeks we have to rest. So about the facelift, the rhinoplastic, and the arm lift, there are they have the same time to come back to the work. Maybe it's gonna take 2 weeks, but the tummy tuck, the breast procedures, the thigh lift, and also the tummy tucks, maybe it's gonna need 4 weeks. That means that 1 month you have to rest. So that's the difference between the time, the timing of to return to work. And maybe exercise, all the patient can exercise after the week 4, but just like cardio kind exercise like walk, like you can go to maybe running, you can go to the scale, and that kind of procedure. The full resume exercise you can start in all the procedure after 2 months. Okay, so that's the point of the cares after the surgery. This is a important point after the surgery. Also, the exercise can improve all the results, and you have to keep the result because if you don't care about your body, your results can last too much because you need to exercise and try uh, to have a good food. That's mean that all groups of food you have to eat, but also in the quality and the quantity, it have to be so good.
Thank you so much, Dr. Peter. Again, the
Welcome.
hospital, we are offering so many different things as spa. We actually, of course, we were talking about recovery. For example, hyperbaric chamber, where they put you in 1 hour in high atmospheric pressure, helps quite a bit with tummy tuck and any kind of skin removal. So we highly recommend that, and we offer it, but now we're gonna have it at the spa. Of course, Botox, skincare, exosomes. Um, we you can take advantage of that. We're talking about our the all-inclusive um all-inclusive packages that we offer, right? So we customize the number of nights that you have to stay before, after, during the hospital stay. Again, you have option to stay in the hospital throughout your stay, and we can arrange for that, especially if you're coming by yourself. But everything is included, including the garment if you need it. Okay. And we have a special offer for hyperbaric chamber. We highly recommend you do that. Um, and as I mentioned, the cost that, for example, a mommy makeover that we offer is probably 30% of what you would have paid at home. But remember, not every plastic surgeon is specialized in post-bariatric patients, and they cannot do in that limited OR time that I mentioned within the 6 hours to do the multiple procedures in a mummy makeover that we can perform. Our most popular package right now is our mummy makeover and of course face. We do a really good job on the facelift and we're getting quite a bit of requests. And again, those that are looking especially for face, we have um, a long wait time. So to get that day that matches your schedule, please do your paperwork faster, put the deposit faster, work with our coordinators. So these are little benefits of going with us. We do your FMLA paperwork, we do your transportation, we do your hotel, we have a underground nurse that is always in the hotel helping you. Um, so these are all the benefits of going with us. We monitor the surgeons. We want to get the best surgeons for your surgery. The hospital is a state of the art. We keep you 2 nights, at least 1 or 2 nights. And the hotel is great for you, for your companion. You get quality medical care that you can't even get in US. There's I just need to touch base on this. You know the difference between a young pilot that just started flying than a pilot with 10 years of experience. This is an analogy I always do between an assistant surgeon or a new surgeon and an experienced surgeon who has done hundreds and thousands of these procedures. Another benefit of going with MCC is we offer medical tourism insurance is mandatory and is $199 that we add to your package, but this is at least half of off. Even I mean, this is you cannot get this about you have to spend $700 to get this package, but you get it for $199. Is best coverage that you can have. We just released financing, so easy. If you're looking for financing, just ask your coordinator. We would send you, we can actually finance you up to $10,000. Very easy to qualify. It's a matter of minutes. Very easy interface. We send you a link. You go put your information. They do a soft check, bang. You're done. It's very affordable. It has the lowest rates that any financing company can offer you, and it's so convenient. Again, if you need financing, let us know. This has been a game changer. Okay, I'm going to release the Zoom poll, and let me, okay, so you make sure I do this. Okay, so now you can start answering the Zoom poll. And we start answering your questions. That's great. We finish our presentation in 1 hour, so we're going to spend maybe half hour try to cover all the questions you have. Dr. Lopez, are you ready? Yes, you're still in mute. If you want to unmute yourself. So the first question is actually a multiple question. It says, what tests are you performing when you uh, when we arrive in Tijuana?
Okay. That means the labs that we perform.
Yes.
Okay. We try to know about your hemoglobin, about your glucose levels, and also about your proteins level. That's three things are so important to know if you're gonna have a good healing, if you're gonna have a good process. So that's called um, uh, um, I don't know how to say that chemistry. Well, here is chemistry chemical. The labs it's not like that. And but the point is that these 3 points that are the most important to know before the surgery.
Okay, so if I can just interrupt you for a moment. So that's why, if you recall, at the beginning of the presentation, I said, please do a blood hemoglobin test a month before you arrive. So when you arrive, you will not have surprises. Of course, if your hemoglobin is down, we can fix it, but then it would cost money. You'll be delaying your surgery. So best is to make sure you come in, especially if you're doing combo surgeries like Mommy Makeover, your hemoglobin is high. Now, one more thing I need to also mention is if you're coming for the stellar stem cell pre-op, if you have a history of cancer or somebody in your family had history of cancer, you need to come 2 nights before because we do also a cancer blood screening, cancer screening, so we need more time. Of course, this is all done. We do your EKG. You talk to an internist, general doctor that has been with us for years, and making sure everything in your health is great to proceed. Go ahead. Now they're asking, how many weeks after Mummy Makeover can I travel back?
Okay, you can travel after 1 week because you're gonna get drains. So we need to remove all the drains before you leave the hospital or the hotel. So maybe it's gonna take 1 week at
And
least. Mhm.
yes, and then also they're asking the same question. If I don't have a companion, can I stay throughout my stay in the hospital? Of course. Again,
Yeah.
we can arrange for that. Um, okay, so that was another thing. They're asking, do you perform surgery on Black people? And because all the pictures are white, we apologize for that. Of course, we get a lot of patients. African American, and we get all type of patient, different races, different from different parts of the world. So we're familiar with all type of patients, whether you are African American, you're white, whether you're Asian. We have or Middle East. Actually, I we just had a Middle Eastern patient. So it's all sorts. So you don't have to worry. I apologize if we just put the pictures in one way. Okay, so next, how much maximum skin can be removed during an arm lift?
This depends of the patient because again, if you don't have a good level of hemoglobin of protein, we can try to remove too much skin. The other point of the arm lift is the centimeters that you have before the surgery. So that all of these treatments are really personalized to you. So you can get maybe 30% or 50 up to 50% uh, to get removed the skin that you have before the surgery. So I hope that this respond your answer.
So do you also perform lipo on the inner thigh surgery?
Okay, for a thigh lift, if we wanna perform a thigh lift, that means to remove the skin, we always try to make a liposuction before the cut. Why? Because that protect the lymphatics and the vessels that are under the skin. So we try to protect with a liposuction, and after that, we just get the skin that we're gonna remove. That's the technique that we perform to make the safer procedure for you.
Okay. Um, so for eyelid lift, upper and lower eyelid, and eye surgery plus fat grafting to the face, how many days do you recommend I stay in Tijuana?
Okay, in Tijuana, you can get maybe 3 to 5 days just to get the suture removed, because we place external sutures in order to don't get a scar. So we need to remove the sutures. So you're gonna need 4 or 5 days maximum.
Are you inserting the implant under the muscle or over the muscle?
Also, this is an interesting question because it's gonna depend of the patient. Most of the patient have a good muscle, but in many cases, patients don't have a good structure of the muscle. So that's gonna depend in the revision consultation that we're gonna have before the surgery to decide if I can
Somos
place under
sa high
or over
school
the muscle.
oradan hocası gibi duruyor. Okay, so can you explain saline versus silicone implants?
Okay. We here in Mexico, the saline implant doesn't it don't use it. We don't use it saline implants. Why? Because they can get broke, they can get explode when we are putting on the pocket. So maybe this kind of implants that are not safe in this area. So here in Mexico, we don't use saline implants. We use the new technology silicone implant. So that's mean that you don't have to have a replacement maybe in 10 years, in 15 years. You don't have to replacement yours in the case that you can get a contracture, or maybe you have a bad screening of your breast because they can find something that you are not that you have a history of tumor or cancer, or maybe if you get a illness like arthritis rheumatoid, or maybe like a lupus. So that's the indications to remove an implant. But right now, the new technology of the implant, the silicone implants, you can last forever. I mean, all the of the life with the implant. So that's the point of to use the silicone implants with the new technologies that also we have and the Hospital Azar.
The Misha is asking, would I be able to fly back after BBL procedure? I believe that she's referring to actually uh, implant, not just a fat injection. Or I don't know if, anyway, if they get anything butt lift, can they travel after procedure?
You can travel, but you have to wait 1 week at least. You can come back to your home the next day of your surgery, because the risk of thrombosis is really higher with this kind of procedure. So if you want to come back to your home, you need to wait 1 week at least. And we can use implants and also fat, or a combined procedure in order to improve the shape of your butt.
Now, one thing that is usually we recommend is to get pillows for your travel, whether it goes under your seat or in your back or your neck. So you need to look into those pillows also for easier traveling.
Yeah, we try to recommend you that kind of pillow. There are a special post-operative kind of pillow to travel, to have a long last travels.
Yeah, and it also depends on the where how far you are, right? If you are um if you're in the plane for 1.5 hours or 5 or 6, that makes a difference. Um,
Yeah.
so do patients go back home with their drains?
This depends of the days that you're gonna stay here in Mexico, and it's gonna depends of the volume, the liquid that you have during the days that you are here. So there are amounts that we can remove with that measure of volume. We can remove the drain. But if you don't get that centimeters of volume that we needed, you're gonna come back to with your drains, and there they can be removed. It's not necessary to get a plastic surgeon to get removed. It can be in a nurse with a nursing staff or a medical general staff. So that's not a point to get removed. But this is important because we don't want to get inside of you liquid. So it's when it's necessary, we have to remove them, and what is necessary to get with that and come back to your home with the drain, also it's a point. It's gonna depend of the patient, because the patient are two different. I can make sure that that patient gonna be can get removed the drain after 3 days, but the other patient in 1 week. It's two difference of the patient, and it's gonna depend also the kind of procedure that we perform. Obviously larger procedures have too many days in comparison with maybe shorter procedures.
Let me give you some ideas. Like, for example, for Mommy Makeover, we probably keep you, again, every patient is different. The amount of skin we remove, the type of surgeries we do, how many procedures we do in one surgery. These all depend how many days you stay. But in general, let's say for a Mommy Makeover, you stay 1 night pre-op, 2 nights hospital, and probably 4 nights after. This is again a typical package, but every patient is different. Every case is different. We tell you exactly, but that's just like a, general to give you general idea. Um, uh, Angelita is asking, I had breast implant done before I had my bypass at MBC. Now they're too large. That I lost weight. You remember I mentioned about BMI? Actually, Dr. Peter
Mm.
Lopez is one of our most strict doctors for BMI. Doctor, we see this in US that they don't care what type of BMI you have. They give you what you're asking for because they want to take your money. I see patients over 40, 45, they get tummy tuck. So what can
Yeah.
happen is they need to go back now, lose weight, whether they come get surgery like this lady get bypass, and then they find out, oh, I need to get a revision, whether very simple breast implant or it could be a mummy makeover that they got tummy tuck. They want to take your money. We pay attention. We also have these wide range of services that we offer, right? So if you go to our bariatric center, we feel that's the best for you. That's what we're going to recommend. We're not going to give you a surgery just to do the surgery. Um, Yeah, we can fix that, right? She can come back for revision. Yeah.
Yeah, actually, it's a good point to emphasize, Ron, because the VM app is really important. Also, this is for the safety of the patient. Here in Hospital Azar, we really like to have the patient with a good cares and with good results. If you have a good BMI, you're gonna get a good results, a good recovery, and you're gonna be happy with your results. So that's a point of to have a good BMI before your surgery. The ideal BMI is 30 is the point, the limit of the current BMI to get a cosmetic surgery. Obviously, if you're gonna get a bariatric surgery, this is too different because it changed the point.
Um, Anne is asking, can you do a breast augmentation, fleur de lis, arm lift at the same time?
This is called a mommy makeover, but remember, it's gonna depend of your level of hemoglobin. If you have a level of hemoglobin over the 13, you can get a mommy makeover with these three procedures. But if you don't have, maybe we have to choose two procedures that gonna be more beneficial for you. So this is for your safety again. We in this hospital we try to make the procedure safe for you.
Um, so can you do in Mommy Makeover, can you do arm lift, thigh lift, and tummy tuck together?
Yeah, it can be possible, but we don't try to recommend to have in two extremities because you're not gonna be able to move to have the movement. So if you don't move after your surgery, you can get thrombosis. So we try to don't choose do extremities. That means that arms and thigh we try to put into different stage.
Again, we our recommendations are based on what is best for you, right? If we say it's not a good idea to do arm lift and thigh lift together, it is possible, but it's best for you to do it separate. Um,
Yeah, actually, sorry, Ron. If, for example, the patient wants these two procedures together, you have to bring uh, so a familiar in order to take care of you because you can get by yourself
yeah,
of the movement. So
your movement is limited. You need to bring a
limited.
yeah.
Yeah.
But again, like Dr. Peter, we run into, for example, in our orthopedic center, right? A lot of the patients in US get both knee replacement at the same time. We don't recommend it. It's not that we can't
Yeah.
do it. We can do anything, but we always worry about your recovery. We worry about, it's just not getting the surgery done. We talked about that, right? Recovery, post-op care, even from your diet, your exercise, your wound care, your incision care. It's huge to have a flat incision when we say let's do a hyperbaric chamber because that helps your skin to get oxygen so we recover faster. So we're doing all the the things that we're doing for your benefit. um okay, so I have had previous arm lift. Can I can you redo my previous arm lift?
Yeah, we can perform this. This is called like a secondary arm lift, and we can remove the last scar that you have, and we can remove also a amount of skin that you have after the surgery. So it can be possible. So it needs to be with evaluation in order to decide what kind of arm you're gonna get, maybe a mini, a standard, or a extended. It's gonna depend of the result that you have right now. So this is possible.
Okay. Okay, so the screen I showed you with the cost, remember, these are starting prices. Every patient is different. The number of nights you stay there, the amount of skin we have to remove, all depends. Every patient is different. What we put in the procedure for your package is different. So those prices I showed is a starting, for example, facelift. We were talking about just mid face and jawline, right? Starts at 9,800 and it goes up. Some people want the eyelid or upper eyelid, all that stuff that you want fat grafting. We do stem cell in the facelift, so we do a lot of different procedures. I wanted to mention actually the technology we're using, the advancement of our surgical teams. For example, in some cases, when we do a circular fleur-de-lis circular often, but we do the vertical from the inside, so you won't have a scar. So there's so many things that our surgeons are doing. I didn't have time to explain. We have the most expertise in-house, and we know what surgeon is capable of doing what. Okay, so um, now Victor is asking for males. Is procedure basically the same? I want to focus on chest and abs. Um,
Yeah, yeah, it's possible. I want to know if he is a post-bariatric patient.
yes.
Yes, okay, perfect. About this,
I don't
you
know
have,
him.
okay. Okay, you have to keep in mind that if you are a post-bariatric patient, it's possible to get apps, but not in one procedure. It's gonna need it two procedure. First, we try to remove all the skin that you maybe have with that excess of sagging skin. After that, we're gonna repair the muscle inside of you in order to have the natural position. After that, maybe in 6 months, you can get a liposuction in order to get a better contour, and we can make all these apps in order to have the improvement of your body. But you have to keep in mind that this kind of procedures in post-bariatric patient, it have to be into a stage. But it's possible totally. And yes, it's different to a female patient, because in men the abs are too different, and the muscle are too different. They are more strong. They are stronger. So it needs to be more maybe with different sutures and different techniques in order to get a natural shape and a good shape. So it's possible, and it's too different with a female procedure.
Um, so how many days, again, they keep asking about the stay. We would tell you exactly, but normally you can think about like if you get a facelift, which is like mid face, upper, lower eye, you're probably looking at 1 week, right? Usually with Mommy Makeover and facelift like that, you're looking at 1 week.
Yeah.
But again, we tell you exactly. If you need the forehead, if you need something else, then it would extend your stay. You make sure you're well to go back. What brand of silicone implants do you use, doctor?
Okay, we use Motiva implants. That are the best implants, the best technology that there are here in Mexico. So there is called Motiva. And also after the surgery, we're gonna give you a guarantee card in order to have make the registration of your implants in order to have this guarantee. So that's the point of use this kind of implants.
Yeah, so you get a serial number that you can go online, and each implant has its own. So if you have two
Yeah,
implants, you have two serial numbers that you can register. Make sure you get that serial number before you leave.
yeah.
If my hemoglobin is 12, do you have to get iron infusion?
Okay, if you have that level, this is on the limit. We can try to improve. It's gonna depend of the procedures that you want. For example, if you want just a tummy tuck, it can be useful that level of hemoglobin. If it's maybe just a bread leaf, it's useful your hemoglobin. But if you want a mommy makeover, that means that there are three procedures in one stage. You're gonna have to improve your hemoglobin. So you're gonna need iron, but can be oral or intravenosus in order to have maybe to improve 1 or 2 grams more of the hemoglobin.
Monica is asking something I don't understand, Monica. It says, is the outside clinic separate cost? Oh, I think when they say recovery, um, so basically our package covers everything from the pre-op to hospital to post-op by the time you go home. Of course, if you need something extra, there's going to be extra cost, but the package covers everything in a standard patient. Um, Miriam is asking, I had saline implants under the muscle. Do you have the implant exchange, and what is the likely new would go under my muscle again?
Okay, if you want to get replace your implant, it can be possible, but we need to evaluate if they look so good in order to have a good round shape. So that means that maybe you're gonna need a bread leaf with an implant replacement. So the size is gonna be decided if you know the size of your actual implant in order to get maybe the same position and the same result that you want. Obviously, I don't know if the patient wants teeny implants in this stage, or maybe she wants larger implants. So that's gonna be in the consultation. So it's gonna depend of the patient, but the answer about the replacement, it can be possible, and under or over, it's gonna depend of the shape of your breast in that moment, on the moment of the revision.
So Anne is asking, can we get breast lift, arm lift, fleur de lis, tummy tuck at the same time?
Again, it's gonna depend of the level of hemoglobin,
I know, of course,
because
yeah. How
yeah,
much skin do you have to remove, right?
yeah. Yeah, because maybe she's a teeny patient, for example, and maybe it can be possible if the skin that we have to remove is not too much. It's not a larger procedure. That I mean can be possible, but it's gonna depend of the patient and the hemoglobin. So that's why I always make the invitation to have a consultation, and to have the the touch with us, with Tiffany, with all the people that are here in order to get the best procedures that you're gonna have.
Again, if you guys, for example, have any requirement or request, let's say everyone's body is different. When we talk about BMI, it's really just a number, right? It depends how our bones made, how our frame is. Are we small frame, medium frame, large frame? So when we say BMI, it's just an indication. So if you guys you get when you send your picture, we look at everything together. We are looking at your case specifically, at your body, at the amount of skin you want to get removed, your health history, your age, all that comes into picture. If you are a post-bariatric patient, if you're not, so everyone gets a free consultation and free recommendation of, okay, this is what we recommend for you to do. And if you say yes, then we proceed. And still, this is another thing I need to emphasize, which we didn't get to. The final surgical plan is determined when the surgeon, Dr. Lopez, for example, actually see you in the hospital, they mark you, and they talk to you and making sure that this is exactly how you want to look, this is how exactly you want the procedures done, and that's when the final plan happens. Everything that we're doing is including your health questionnaire. All that is just to get you there. Once you're there, you have a chance to talk to the surgeon again and make sure. Sometimes we add some procedures, sometimes you remove some procedures. Most of the time, it goes like it was planned. But there are cases that we can modify. Hey, I need to add BBL, or I need to have little bit maybe bigger implant or low. So everything is happening down there. When you talk to the surgeon, he marks you. Okay. Now, if you, for example, have um, if you want to stay a plus size woman, tell this to the coordinators. We do have surgeons that can, or they're more toward the higher BMIs. So we can accommodate that too. Okay. So we have all type of surgeons that do all type of procedures. Um, so do we keep patients in the hospital after eyelid surgery only? So again, it's not necessary. And when I said up to 2 nights, so those are pretty much for the bigger surgeries, right? If you just get an eyelid surgery, I think is in and out. You don't have to stay. It's an easy surgery. Um, okay. Now, we do have lipo 360, which we will give you the definition. We can do stomach etching and all that. So this is a question again, Dr. Lopez, if you can ask it. How tight do you repair the abs without affecting function or breathing?
Okay, this gonna depends of the separation. That's mean the diastasis of the rectus that you have. So in many patients, they have 10 centimeters. Other patients have 20 centimeters. Most of the patients have maybe 15 centimeters. So it's gonna depend of the separation, the centimeters of separation that you have. So the limit is to get the muscle together, like this the natural shape. Okay, so you're gonna get the joint of this muscle in order to get your natural shape. We don't try to maybe stretch or be tight more that can be possible, because obviously that's gonna affect the pulmonary dynamic. So that's the point, to get together your muscle, and after that we can get 2 or 3 centimeters in order to have a support of this joint. But just that we can perform more that your body can get.
He's also asking, they're also asking, can you do ab etching while you're doing a tummy tuck and muscle repair?
Yeah, actually, the tummy tuck is combined with the muscle repair. Always, when we perform the tummy tuck, we always try to repair the muscle in order to get remove the excess of the skin in the central and lateral area. So that's a procedure that we always do with a tummy tuck.
And here again, another thing, we are very cautious about the number of procedures we do in one operation. And if some centers told you they can do more, um, I would, caution that, because we have the most skilled surgeon, most experienced surgeon with the fastest time to do the surgery. So if they tell you that Again, they're not going to be worried about how many hours you're under anesthetic. You're not going to worry about your recovery. They just want to give you what you want to have a business. Um, so we're getting close to, we passed the 1.5 hours. I'm going to try to, um, okay. So the webinar is going to be uh, published in YouTube. All you have to do is ask your coordinator for a link. Probably give us until maybe Tuesday. So once we have it on the YouTube, we can send you the link. I mentioned about FMLA, yes. We have like 19 questions unanswered. Again, please, if we didn't get to your question, please go ahead and ask our coordinators. We will get back to you. No problem. Just okay. So what I'm going to do is I'm going to stop here. I'm sorry if I didn't get to all your questions. And this is the raffle. I'm trying to do the raffle again. I'm going to pull one name here. And let's see who's the name. Um, I'm going to show it to you and then read it. Robin Wood. Robin, if I can let you speak to us and tell us more about yourself. Okay, there you go. You are on, if you have to unmute yourself, Robin, if you want to talk to us. Congratulations. Robin, I am allowing you to talk to us. If you like to talk to us, you can unmute yourself and tell us about yourself. Okay. Well, let me see. Somebody raised their hand. Who wanted to talk. Okay. Well, I appreciate you, Dr. Peter. Thank you, everyone, for attending today and being with us. I hope this was helpful and helped you get some insight into the procedure. The more education you have, the more transparency we have, the better the outcome. We see you next
Yeah.
time, or we see you down there in Tijuana. I appreciate it. Thank you so much.
Okay, thank you.
Thank
Have a
you.
good day. Bye.